first thing we need to understand that when we're dealing with coding, accuracy matters. Now, there is a lot of reasons why accuracy matters. Number one, because of coding accuracy and compliance is vital for revenue integrity. Revenue integrity is a huge part of what we do, and that's often linked to the coding. But coding truly is a statistic, and we code for statistical purposes. It happens to be a convenient way to get paid. But to truly make sure that reimbursement and that revenue is coming in accurately and with integrity, we have to make sure the documentation is clear and the coding is precise in the translation that we're doing. Now, how do we do that? It's collaboration. So, collaboration with the providers, or if you prefer to be called clinicians, we can say that too. It improves really the overall documentation quality. And we're going to talk quite a bit about that as we move forward in this presentation. The next thing you need to be aware is to identify documentation gaps, and that's going to help in specific coding processes. Now, what that means is that when we do the documentation and then it's translated into the codes, we need to see where things aren't lining up, identify gaps. And once we identify those gaps, we can initiate protocols to close those gaps so that again we have revenue integrity, but we also are capturing statistics properly because now we have the use of AI to help us understand the statistics, both from a revenue side as well as a clinical side. And we want to make sure we get it right. Another thing to be aware of is that clinical documentation improvement techniques enhance the medical records. Now, medical records are legal documents, and we want them to be accurate. We want them to be easy to translate into the code set, easy to understand, and we want to make sure they're covering all of the bases when it comes to protocols, procedures being done, and the CDI, the clinical documentation improvement aspect, become also compliance. It's very important. It really takes a team to make this work. Whether you are a physician, a sole practice physician with your own clinic, or a multi provider clinic, or multi specialty clinic, or a large teaching university hospital.